want it to have a decent amount of contact time in order to be effective at killing the fungus. Now, the typical spots for this fungus are usually the extremities, so tail, tip, and feet. But you'll see that we're doing her whole body, but Maggie will be focusing a little bit more on her feet and tail. There's several types of fungus that dogs and cats can get that raccoons can also get. The most common one is called Microsporum canis, which 70% of your dog and cat fungal infections are going to be that particular one. But our raccoon, when we typed it out, had Microsporum gypsum, which is about 20% of your cases that you see. And the good news is it's a fungus that just sort of lives in the soil, in the ground. And because this little youngster was young and probably a little immunocompromised, she picked up this infection. But as you can tell, it hasn't made her feel sick. We just really want to make sure to accelerate her healing. In fact, in a lot of cases, it would in fact resolve on its own, but because she's living in the hospital and we want her to be able to play with her raccoon friends that we have here, we do this treatment every 3 days, and it will actually be for a minimum of 1 month, maybe even longer than that. So you can see that she's tolerating the bath pretty well, and luckily, based on her age, she's not biting us too much. If this was an adult raccoon, we would absolutely need to do sedation. An interesting fact, when we found her, she was only 385 grams, which is about 12 ounces for those who aren't familiar with the metric system. And in her short time with us, she's already doubled in size. So she's well over a pound now, and she's doing really well on her growth chart and doing all the raccoon things that she's supposed to do. One of the things that we have to be careful of here when we're treating patients like raccoons is we want to make sure that they keep a good fear of humans. So other than her baths, we really try not to have too much contact with her other than her feedings, because we don't want her to think of humans as a source for food or comfort. We want to make sure that, she knows to spend her time with raccoons, and when she's old enough to release, that she knows to run far away from humans, which in a way this bath probably is helping with that a little bit. So Maggie's got a nice lather in the most important areas, and the medication that's in the shampoo is doing its thing. These shampoos are designed also to be a little bit soothing. You can imagine if you have a real crusty, dry area that it could be a little irritating and even cause a little discomfort. So the bath is a very soothing treatment as well. And there are oral treatments available for fungal infections, and if it was a very severe infection, we would certainly go that route, but they can cause stomach upset, and they're just really not necessary in very mild cases such as hers. Because as you saw in the beginning, she just had that little bit of crust on her tail, and it's certainly improved tremendously since she got here.
We have a question from Susie. She wants to know what the chances are of her surviving in the wild are.
Her chances are actually excellent, because we do a wonderful rehab program for raccoons here at South Florida Wildlife. After spending close to 12 weeks inside with conspecifics, in other words, other raccoons, she will go to an outdoor habitat where she'll spend another 4 months learning how to forage, how to hide. She'll be offered logs and climbing opportunities, and she'll be with anywhere from 4 to 5 other raccoons. And by the time we release them, they're at an age where they wouldn't be with their mothers anymore, and they have all the skills that they need to survive in the wild.
That's great. We have a question from Marianne, and she wants to know, why are her ears pink?
So our raccoons are put together in groups so that they can be with their own kind. And when we need to know quickly which one is which, we like to have a color identification. So we actually use a very natural nail polish to put a color identification on their ears. And when we do their regular weighing, we touch up the color on their ears. So we call her our pink female raccoon, and when we go to get our raccoon for treatment, we can easily spot her in the group, and we don't have to grab every single raccoon each time we want to work on her.
Great. Do you want to tell us a little bit about the South Florida Wildlife Center?
And I didn't have a chance to say, my name is Dr. Renata Schneider. I'm one of the veterinarians here at South Florida Wildlife. We've been open for almost 50 years. Next year will be our 50th anniversary. And we are the largest wildlife trauma hospital in the country in terms of the number of animals that we treat. So this year we'll treat probably about 12,000 animals. About 60% of our intake is birds and another 30% is mammals. So we do raccoons, squirrels, possums, foxes, the occasional coyote, and then we also treat about 10% reptiles, the occasional amphibian. We've even had a butterfly with a broken wing presented to us before. And everything starts in our hospital, and when the animals are medically cleared, then we have an entire team of folks who work on the rehabilitation aspect to get them ready for release in the wild. And raccoons are very playful animals, very dexterous. They have hands that are really good at getting into things, breaking into things, as people know, as she's showing us today.
For those just tuning in, we are at the South Florida Wildlife Center in Fort Lauderdale.
Ready for her rinse? Mm-hmm. So we're going to rinse her with some warm water to keep her comfortable, and then she'll be dried off. Just kind of. Okay. Poor baby is really quite fed up. So I'll just put her under that running water and get all that stuff off. We do have incubators that are kept nice and toasty warm so that when the animals are wet from bath or another treatment that might cause them to be wet, they can stay in a warm incubator while they dry, and then she'll go back with her cage mate. She is ready to be done. Gonna make a little burrito here. They're nice and dry. Does anyone have other questions that I can answer?
Someone asked if you name your animals.
We actually don't name them. Partly we don't want to be attached and we want to keep them wild, and part of that is respecting that wild animals don't have names. Every animal gets a case number, so because she came in on July 7th, she'll be 18 for the year, 07, 07, and then her last two digits are the number patient of the day that she was. So she was the 6th patient, so she's 18, 07, 07, 06. As you can see, they're so cute, it would be really hard not to get attached, and it's hard enough for us to not want to play with them and let them stay on their own. We don't want to attach cute names to them as well.
That makes sense. A few people have been asking if raccoons like water, if when they're not,
Yes, they
forced to take a bath.
love water. In fact, they love dripping water, and here at South Florida Wildlife, we have rain barrels set up outside each hab, so that when the rains are plentiful, we can keep it open and they have a constant dripping source of water, which they love to put their hands in. They also like to take their food and dip it in water before they eat it, if it's not already a water food, such as a fish. So they'll take dry food and dip it in the water and eat it that way. For them to give them bowls of water. Sometimes we'll take fruit and freeze it and then put like a fruitsicle in their water, so they have to play and work at it for it to thaw to get at the food, and it keeps them real busy and happy.
Rhodey wants to know how many raccoons are in your care at this time.
Right now we have about 100 raccoons in our care, 30 in our nursery and 70 in our outdoor habitat. So you can imagine as they come up for release, it's one of the more challenging things that we deal with here. And if anybody ever has a large property that they want raccoons released on, we encourage them to get in touch with us because, as everybody knows, with development, the places where you can release raccoons are limited more and more every year.
Edith wants to know if you track them once they've been released into the wild.
We do not. It would be very hard to track them. It requires radio collars or satellite devices. We did for 1 year put microchips in them so that we could identify if raccoons came back sick or injured if they were our own. And after chipping 600 raccoons in a 2-year period, only one came back with a microchip, and it had survived in the area where it was released for 8 months and then unfortunately was injured. So we think that they probably do pretty well, which is why they didn't come back to us in that time frame. But without a live tracking system, we don't know for sure.
Oh, that's interesting. Robin has a question. Oh wait. Oh, Annie wants to know what does she eat?
So raccoons are pretty omnivorous. So they eat meat and fruit and veg. They love insects. Anything that's on a tree, in the ground, in the water, they'll go for. They'll eat frogs, fish. Here at the South Florida Wildlife Center, we'll use dog and cat formulas and dog and cat chow to supplement their protein a little bit. But they get all kinds of fresh fruit and veggies and insects and all that good stuff.
And a couple more questions. Robin's asking for some advice. She says, "In the field next to my job, there's a baby I've been feeding, but who will rescue it?"
The best thing is to let the mom take care of it if she's still around, because we definitely don't want to intervene unless we absolutely have to. There aren't really groups who rescue healthy raccoons. Our mission is to help sick, injured, and truly orphaned. If they don't want the raccoon anymore, there's different deterrents that you can use, but if the raccoon isn't bothering anybody, better to just leave it be and learn how to coexist with wildlife.
Good to know. And one more question from Marcy. She wants to know, where do the animals go that can't be released back into the wild?
Well, our mission here at South Florida Wildlife Center is to raise animals healthy enough to release. In the rare event that there's a raccoon that comes in already super used to people and too friendly to release, we work with the Florida Fish and Wildlife Conservation Commission to find permanent placement for them, but those are rare. And those that are far too injured or far too sick to be saved are humanely euthanized so that they don't suffer.
All right. I guess that's about it. So thanks a lot to the South Florida Wildlife Center. You should check them out on, where's the best place to get more info?
FloridaWildlifeCenter.org.
All right, check out that website if you're interested in learning more about them. Thanks so much, everyone.